Hello and namaskar, I am Sanjeev Pandya welcoming you to the Ayurveda Mantra Show on TV Asia. In this weekly show, we talk about importance of Ayurveda and Panchkarma with Dr. Ambika Nair of Santigram, Kerala Ayurveda Wellness Centers, USA. Dr. Ambika Nair, having 30 plus years of experience in treating individuals through Ayurveda herbs and Panchkarma treatments, advises and guides all of us when it comes to Ayurveda, which can cure practically almost every disease out there. I'd like to welcome Dr. Nair to our show. Dr. Nair, how are you?
Hi Sanjeev, thanks a lot for inviting me for the show.
Yes.
Thank you, my dearest viewers. Hope you people are enjoying it. If you have any doubts, please do send email.
Yes, and you can send us your email at info@santigramusa.com. Moving on to the show, in this episode, we're going to talk about something, I would say, we always talk about something very important, but this might be related to many of our viewers out there and their family members as well. It's called hypertension. According to some report, the number of people living with hypertension is predicted to be 1.56 billion worldwide by the year 2025. In the US, around 75 million people have hypertension, with more people dying of hypertension-related cardiovascular disease than from the next three deadliest diseases combined. Dr. Nair, tell us what is hypertension and what causes hypertension?
What is hypertension? I tell. Normally, when we check the blood pressure, we call it as the numbers, 120/80, 110/70. Array, low BP ho gaya. Some people, like with hormonal imbalances, they will be little high, like heavy looking, obese, but their blood pressure will be always on the lower side. But 90/70, jaise thak jata hai jaldi. Okay. So when the number, like 110/70, or that is also normal, but 120/80, when it start like increasing slowly, okay, like 130 ho gaya, then systole will be like 90, you understand? No? So any changes in the diastolic and systolic variations, okay, then we call it as like a pre-hypertensive.
Okay.
Everybody, like ekdam BP, it's very rare, but like it comes, but only people, like we don't understand why it is like that. बोलेंगे ना देखो इसको इतना ज़्यादा गुस्सा आ रहा है, check his blood pressure. See, me means I will tell that उसको just check करो. Because their blood pressure, sometimes it will be like a 140/90.
Correct.
Maybe like a 150/100.
Yes.
So that's a dangerous question.
Yes.
So the blood pressure normal से ज़्यादा बढ़ना शुरू हो गया. And it is like, see, that's why we tell anybody to check it in the same time. When they get up in the morning and, like after the work, like maybe like 7 a.m. in the morning and 7 p.m. in the evening. So we tell them to record it like 3 days in the same time and see the variations. Okay. Then we cannot establish somebody with anxiety, the blood pressure goes.
Correct.
So there are certain factors also, the causes I am coming to that. Okay. But nowadays, this blood pressure is taking a big toll of life.
And what actually causes this?
Yeah. First itself is our lifestyle.
That's right.
We have no time because it is a lifestyle disease. This we can always take care. But we never bother for that. Okay. Then, like a tension, then like stress, sleep, anxiety, depression, endocrinology, that is related with all the hormones. Okay, whether it is female or male. Okay, then incompatible, food habits. We eat whatever we feel like. Coming from Gujarat, we will be eating only pasta over here. Coming from Kerala, we will only go for pizza. So this all, whatever we ate in the childhood, we can modify it, but slowly. Okay, that all, makes a lot of difference. Then, like bad habits like over drinking, smoking, Because this all makes the hardening of the arteries and it really creates a lot of problem.
But it's not only that, because I have seen some people, they don't drink, they don't smoke, but they still have this blood pressure problem.
That's a very good question.
And actually, in the day, right, just like you say, in the morning or in the afternoon, in the evening, their blood pressure actually varies. Sometimes it's okay in the morning and the afternoon, and all of a sudden in the evening,
yeah.
it just goes high.
That is essential hypertension, because with the small things they worry a lot and they sleep. Ask them, they will never sleep, because this is all in Ayurveda what we call. This is all Vata related things, See, our excretion has to be, everything is pushed by Vata. See, like a kapha means we are only earth, you understand? No? But the movements, the brain, all this, like ye karo, wo karo, bolne wala to hamara pitta hai, fire. ठीक है पाचक पित्ता like then only we will always that they will tell like go, because our digestion has to be there, everything has to be there. So this is like a teamwork, our body. Then the vayu has to move all the excretions outside. So like in like the causes comes like very like they take a lot of excessive salt, lot of sweets, like what they are not supposed to take, they take. Okay, see, they don't understand actually. See, these things, I should tell that, they should always, add this curriculum in the school itself. Yeah, what they should eat.
Correct.
Okay.
But what can a person do? I mean, we're living in very stressful life. Everyone's stressed out. Everyone, they got tension, right? They're running around, obviously, work-related problems and family problems. And the person is surrounded by so many things. It's very difficult to live a tension-free life nowadays.
If you take tension also, if you don't take tension also, the things what has to happen, it will happen.
Yes.
Okay. This, you have to make understand yourself. Okay. This, like the stress actually, even as a child, that from तुम्हें ये करना है बेटे, वो करना है बेटे, ये करना है बेटे. But I don't say that in America also they will do. They have the freedom to do whatever they want to do. But little guidance has to be there, because even at the age of 28, 30 and all, they are still studying. So that I don't appreciate. But like some guidance has to be there. Okay. See, like kidney problems, blood pressure goes high. But these things we can sleep apnea. Like nobody goes to the doctor. Okay, thoda sa जुकाम हो गया. It is not जुकाम. पूरा ऐसे they cannot even breathe. Their creatinine level goes high. Like everything goes high. Their digestion goes. So that's what I tell you. It's like a machine. अगर सिर्फ पेट्रोल से गाड़ी नहीं चलता ना,
उसको ट्यून अप भी करना होता
हर
है,
चीज करना है, क्लच चाहिए, like your axle has to be there, wheel सही होना चाहिए. But people doesn't understand all those things. They will tell that आपको क्या पता है, what you know about us, because we are very stressful. I told, why are you so stressful? You have taken the life of a human being.
Correct.
Actually, you are blessed to have a life like this. That's your thinking. So you always like certain things you delete from life. Start as dinacharya.
So what you're saying is don't take it for granted.
Unnecessarily, why?
All right.
Yeah.
Very good, doctor. We're going to take a short break, and when we come back, we're going to talk about hypertension in this episode. Welcome back to the Ayurveda Mantra Show. In case if you have just joined us, we're talking about hypertension in this episode with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers, USA.
Hello.
Dr. Nair, you just said after the break that, try not to take tension. Of course, human life is very precious and we should take care of our life. It's easy to say than done, seriously.
No, Sanjeev, I'll tell you one thing. See, if this blouse, if one stitch is out, means a stitch in time.
Correct.
You understand? No? It saves life actually.
Yes.
See, if you know that you have a blood pressure, why you want to drink a lot of coffee? We tell them, this caffeine actually increases the blood pressure. See, I think I have a good convincing power, and I convince them in a proper way that what you are doing, I am not against what you take, but lifestyle has to be changed. Slowly, because if I tell him to, yesterday we had some few doctors with me, then I told no coffee, instead of taking 1 cup full, you take like 1/4 cup. because otherwise, this is an addiction.
That's a good solution. You just don't tell a person not to take
Not
it.
to
Just
take
cut
it
down
slowly,
and in a
because
moderate
after a few
amount.
days, because they will also get accustomed to that, and they will understand what they have to eat. And too much of oil using. We don't need so many fried food. There are so many steamed foods. Okay. See, in Kerala, like in Ayurveda cooking, it is very nice, Not only we call it as our own cooking. So oil is used, but like very little oil.
Right.
Okay. What is needed for the body.
Correct.
Ghee also we use. Everything we use, but nowadays the lifestyle change.
मतलब सब्जी में oil होना चाहिए, oil में सब्जी नहीं होनी चाहिए.
We have to, like not living for eating only.
Correct.
We have to eat to live.
Well, there are people who live to eat and there are people who eat to
Yeah.
live. I think अगर आप eat to live को
Overeating.
follow करोगे तो then you will be much
Overeating.
happier. जी.
They are so voracious, they have no control. This is all with the depression.
Okay. Now salt. How important salt plays a role in this hypertension?
Okay, salt, especially, if you have like a sodium, it creates a lot of water retention in the body. But sodium is also needed, especially for the heart, like otherwise you have a very bad constipation and your blood pressure also goes down. So, like we always tell them, salt is a, white poison we have invented long back.
So salt and sugar is something we just
salt
can't
and
run away from it.
Yeah, sugar cane is fine. Processed sugar after the bleach and all is not needed actually for the body. That's it. पहले गन्ने का रस कितना जूस पीते थे, कोई बीमार होता था, कोई नहीं होता था. उसके बाद तो we used to work.
Exactly.
अभी तो पीकर तो सोफा में बैठकर टीवी देखेंगे. We will not. हमारा शो देखना जरूर है. Okay. So but they will not see all those things. They won't even do any manual work. So physical exercise is needed.
Correct.
Because otherwise you will not be all right.
Correct. How many patients do you normally see at your Santigram Kerala Ayurveda Wellness Center with hypertension problem? And hypertension problem, not just a problem at a low level, right? Really from medium to high level?
It's always on the high level, Sanjeev, I should say. You asked me a question about sodium.
Correct.
So sodium has to be, like it should be taken, especially after like a 35 and all, you start cutting down your sodium. You should always use senda namak, that is little potassium salt, which is needed for your heart. Okay. So this is, you all should remember that, okay.
Is it like
You
a sea
don't
salt?
need it. It is a sea salt.
It is a sea
okay,
salt.
but very little, you understand, no? Yeah, it is more with potassium.
Okay.
In Malayalam, we call it as Indupa, but in that one, we call it as like a Senda Namak in North Indian land.
Okay.
And how we manage, because see, like cholesterol will be there for these patients, high triglycerides. This is all from their lifestyle. This is all from the sedentary work. This is from the liver. Okay, because their digestion will not be all right. So that stomach clear nahi hota. Then their sleep is not right. So this all the predisposing factors has to be taken care.
Correct.
Why they got the blood pressure? That has to be treated. That's why Panchakarma is very important actually. It is very, very important, and the diet and what they eat. It's not a must that I will tell them, oh, don't eat any meat, or I will give them meat. There is no problem. Because so many people ask me, you will make me vegetarian. Vegetarianism also is not that bad, but non-vegetarianism is not at all bad. Okay. But which way you should cook grilled things, they can eat, but not with so much of salt. I told you they can go for senda namak,
Yes,
like that is good. Okay.
All right. When we come back after the break, we're going to talk about hypertension, how it can be cured through Ayurveda. Stay tuned. Welcome back to the Ayurveda Mantra Show. Today we're talking about hypertension in this episode with Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Centers, USA. Before the break, Dr. Nair, you talked about some important things about hypertension and what things really should be followed. We talked about diet. Can you elaborate that? What kind of diet is necessary for hypertension?
See,
people?
we have seen, because of the long experience, we have seen that there are, like children, how it comes in, I'll tell you. Like the children who were never fed on, breast milk.
Correct.
Okay. And too much of salt, too much of sweets, okay. Then caffeine, ladies who take this hormonal therapy, especially after the menopause, they are all prone for this high blood pressure. And even not only that, renal diseases also, some asthmatic cases, this all like, like these people are very prone for all these diseases. Through the food also you get a lot of arsenic.
Achha.
That is, that's why we are all having nowadays, like from the whole food you can get organic food, because they put a lot of manure and all these chemicals. So arsenic poisoning also, it will create all those things.
Okay.
Uric acid, if you eat a lot of protein, if it is not eliminated, that is related to the kidney. So there are, according to the disease it comes like that. Actually we can, 80% we can take care.
Through diet, let's say diet is the most important.
Actually.
So what do you suggest in a diet that one should eat as much as possible?
Okay, very simple things what you can do is that at least do like a 10 minutes exercise in the morning. Okay, like breathing exercises, little brisk walking. Okay, if you cannot go out also, at least 10 to 15 minutes out of 24 hours you should use for yourself. Okay, you also need something for that.
10 to 20 minutes, it's nothing out of 24 hours.
It is a typical dinacharya I am telling to everybody. Okay, whatever quick exercise you can do, you should do. If you cannot go for a walk, park your car little far and walk as much as you can.
Correct.
Another thing is that you should apply oil on your head. In this place,
जब बच्चे थे पुराने दिनों में जो मम्मा कहा करती थी,
all these oils, like this is all very good oils. Our Ayurveda, we have a lot of things according to the constitution. Anybody has anything, I will tell you what to do. Keeping that, because that will pacify you a lot. Your, like vata is pacified, and taking good food. Like good food in the sense, like you can take any food, but only problem is that it should be with so much of oil, so much of, like salt, and so much of spices, very high spices some people use, which will, and even in, like which causes peptic ulcer. So any derangement in the body, it will always cause this blood pressure.
Now, doctor, let's talk about hypertension and Ayurveda and Panchkarma. If somebody has this, hypertension, and someone is very, very affected by high blood pressure, how Ayurveda and Panchkarma can cure that problem and person can live, a happy life?
Recently, one practicing doctor from this New Jersey called me by telling, like my brother-in-law, he had a stroke. So that was, because due to the blood pressure, high blood pressure, he had some ailments with the kidney, and she was taking care of him. But something went wrong, and maybe because of his anxiety, he was very critically, like admitted and saved the life, I should say. So that was in a stroke actually. So it is like a CVA, it is called cardiovascular accident, because the clot formation was there, which made him a hemiplegia. These are the complications. So we always get Sanjeev like all the complications only. Okay, एक साइड नहीं चलता है जी, अभी 1 साल हो गया, 2 साल हो गया, 3 साल हो गया, आप कुछ कर सकते हो? हमारे पास आएगा तो उसी दिन में पेशेंट ठीक होना है. 3 साल या 6 साल वो घर पे था, वो तो कोई प्रॉब्लम नहीं है. That's not the way. Okay, then like because this is like inducing life. So what we do, like according to the condition, we do like in Panchakarma. First of all, we read the pulse and see whether his system is working or not properly. Then Shirodhara we give them. Nasyam we give them, because I think you all are familiar with all these therapies now. Okay, Abhyangam for the body circulation, and there are like like a special lepam we will apply, because if it is a hemiplegia means we won't be able to do like that other treatment. So we do with the paste, like apply, so that it will induce more life in them, and that all the circulation, the impaired circulation will improve actually over there. Yes, so we do like that. Then some people will give vasti, some people we don't give vasti, because according to the situation. Okay, then like pedichil is given to strengthen, even Nyavarakidi, these all special treatments what we do in Panchakarma.
Correct. Now, is this treatment only needed once for that person, or is it repetitive?
No. See, like once they come, some people, their body is not that strong. So we ask them to do like it 1 week or 2 weeks or few days. Then once they, first of all, preparatory stage is there for the Panchakarma. Like, okay, Purva Karma. So we make them, give them some medicines, okay, which are herbal medicines to improve them. Okay, then we call them for the Panchakarma. So once it is done means how the person is, they will be with us only. So, like even though they go to their doctor, okay, primary doctor, they will be going. So, like according to the improvement, their doctor will change their medication. And once they did the therapy for 3 weeks, okay. Even yesterday, in like 2 days back, one of my patient, she was admitted and very bad condition. And now her husband came after 3 years to me. So I asked, how is your wife? Actually, after doing 4 weeks of treatment, because very bad condition, like a total hemiplegia it was.
Really?
Yeah. She was only like a 41 or 42. High blood pressure, she was not taking any medication, not following the diet, fighting with the husband. Because see, like emotions, take a toll too much actually in these conditions.
But it's good to know that Ayurveda and a Panchakarma treatment can cure hypertension. So viewer, if you are having these hypertension symptoms, then number one thing is do not ignore it. Get as much information as possible, and you can contact any one of Santigram Kerala Ayurveda wellness centers near you, and you can definitely get a treatment and you can have it cured. If you have any question about hypertension that we just discussed in this episode, or have any health related question, you can send us an email, info@santigramusa.com. That's our email ID. Dr. Nair, once again, many thanks for all your valuable suggestions and time.
Yeah, viewers, please, my friends, you are not viewers, you are my friends. Please reduce your salt intake. Okay, if you are having a blood pressure, don't eat any food which contains so much of oil, and cut down your coffee. Hope you will understand this and you will follow my tips.
Very good. Thank you for that tip, and we'll keep that Dr. Nair's tips in our mind. Until we meet again, stay healthy, stay happy, and continue to watch this Ayurveda Mantra show right here on TV Asia. So long.